just thank everyone for attending today's webinar on best practices to recover self-pay patient balances, as well as how to promote a successful AR environment, in the pharmacy space. Here's just a quick look at today's agenda, for the webinar. First, kind of want to just set the stage, give a brief overview about who I am, the company I work for, as well as highlight a few important industry trends. Then I'm going to cover some things that you really need to do when contacting your patients, to help increase your bottom line, as well as I'm going to discuss and talk about a couple proven ways to really get the most out of your existing AR staff. Our founder and current president, Michael Teutsch, started an EDI claims processing company in 1999. Really, when sending claims electronically was considered more of an act of magic, I think, rather than the real potential and wave of the future. Now, obviously, he was correct in that that would be the way of the future, and the company evolved into what it is today. And Etactics provides a variety of innovative, web-based, revenue-enhancing solutions to clients really across a variety of vertical markets. Now, we hadn't worked with many pharmacies until becoming a managed healthcare associate approved vendor in 2014. However, in the last 3 years, we've actually helped over 200 pharmacies improve their revenue streams and enhance their business operations. Now, I started with Etactics after graduating from Kent State University in Northeast Ohio, and managed several operational and sales projects during the first 4 years that I spent with the company, at which point I actually left to pursue my childhood dream of becoming a professional golfer. Hey, we only live once, and nobody really wants to have any major regrets when it's all said and done. So I gave it a shot, but after experiencing the professional golf life for a while and realizing that the juice wasn't necessarily worth the squeeze, I did what a lot of people in professional business world don't do, and returned to the company that helped start my career. But Etactics, is a great company to work for, and I'd like to think that our clients would also agree that it's a great company to work with. But enough, about me and the company, since that's obviously not what you're all here for. It's time to kind of throw some earth-shattering statistics at you. So I'm sure everyone here is familiar with the Affordable Care Act. What has it done? Basically, it's expanded health coverage to millions of uninsured people. That's great, for them, but it also started a trend towards increased patient financial responsibility. With these new affordable care, seen yearly deductibles nearly double for both individual and family coverages. Each year since the Affordable Care Act was enacted, we've seen individuals who participate in employer-sponsored coverages select high-deductible health plans. That number continues to increase each year. Within the next 3 years, an estimated 44% of employers health plans as the only benefit option for employees to choose from. So, there's kind of an equation here. Basically, patients owe more, which is equaling a drop in reimbursement rates for healthcare entities. We're now to the point where 30% of revenue is coming from patient financial responsibilities. This is somewhat of an issue for most organizations. Now, there's some things that you can do, initially that I'm sure many organizations are already doing. You can complete in-depth insurance verification checks for each patient. You can submit your claims in a very timely manner, and if applicable, collect patient payments up front. I know that's hard to do sometimes, and that's kind of bringing us into why I think we're all here today, because while we're trying these initial that self-pay balance that's owned. So what's the main goal for an AR department? Well, that's kind of easy. You're trying to improve your company's bottom line, keep the revenue streams flowing, reduce bad debt write-off and days sales outstanding, in trying to recover money that's owed from those self-paid patient balances, before you lose a percentage of that by sending them to a collection agency. Well, what two factors do you need to focus on to achieve, that overall goal? Really, the way you communicate with patients, and by making sure that your staff is doing everything that they can possibly do to recover every last patient owed dollar. Now, how do you communicate with your patients? That's kind of a big key here. Patient communication needs to be intelligent in order to be effective. And you have to consider that patients all prefer different methods of contact. So you've got to provide some different options for them. Giving patients the option to receive their statements, either by mail or electronically by email is a big thing here. Adding call to action letters for past due accounts, informational notices about drugs, or new regulations, or adding promotional content, that's important to do. You need to use your statements really as a means to reach your patients or your audience. In that demographics are shifting. Okay, that's happening. Which is changing really the most effective method of communication. Older generations are now becoming more tech savvy. In a recent survey, nearly 70% of patients actually prefer having the option, to pay their bills online. Many patients are very reluctant, to pay to begin with, let alone to be bothered making, phone calls to submit a payment, or going to the post office. Really giving your patients multiple options to submit their payments, and even the option to enroll in some type of an auto pay, is going to increase your odds of receiving a payment. And lastly, how often are you contacting the patient directly? Have you ever thought about using a type of service that sends automated phone calls or text messages? This is a great way to communicate with patients, without really expending your own internal manpower. And secondly, sending payment reminder emails is another sort of new age method of reaching your patients. And of course, making courteous and friendly live phone calls, using your internal resources or your AR team is going to be a big part of that whole recovery process. So now you know what it takes to effectively communicate with your patients and what those methods are. It's time to address really the driving force behind those communication and recovery efforts, meaning your own AR staff. Now, you talk to any AR manager, and they're going to tell you that their department is overworked as well as understaffed. It's kind of the age-old question, how do I do less? Or excuse me, how do I do more with less? Well, let's first take a look at your current AR management process. Really evaluate that. What are those methods? A majority of pharmacies, PM systems, manage their AR. Now, although these systems have some AR tools, that are built into them, they still require a significant amount of manual labor and time to manage the self-pay patient recovery process. With manual processes in place right now, ARFs are really wasting time looking for information to prepare for a call with a patient. They're updating spreadsheets, maybe they're fixing data errors, their recovery efforts, as well as attending to other really non-value added activities when communicating with patients, settling any disputes, as well as maybe other more mission critical activities that are pertinent to the recovery process. If any of you have ever seen the movie Ghostbusters, there's a scene that I love where they're talking about, vanquishing the evil inhabitants of New York City, and the one Ghostbuster, Winston, yells out, we've got the tools, we have the talent. And I think this quote actually plays into, the message that I'm trying to get across today. You have talented staff. However, they might just lack the right tools to really kind of showcase that talent and work efficiently. Automation, workflow, those mission critical pieces to establishing a productive as well as a successful AR environment. When you use the right tools, you can automate accounts receivable management processes and centralize accounts receivable data to give AR reps the activities that help the pharmacies get paid faster while also improving performance and driving down transaction costs. Without automation, there simply just isn't a way that pharmacies or other healthcare providers can recognize such results and be able to do more with their current staff. I just want to outline what the AR management and recovery process, using a tool such as Etactics' own AR Insight application. So here you have a self-pay patient balance, okay? And this balance is now represented, by this self-pay patient account, okay? Well, the first thing that you would do, using a tool or resource is you need to define, parameters that would basically initiate some type of follow-up on this account. Now, maybe, you as an organization want to start working those self-pay patient accounts, okay? Maybe by larger dollar amounts after just 7 days of sending the first statement. Okay, maybe you don't want to start working account until the balance ages to 30, 60, or 90 days past due, or whatever that trigger might be. And it can vary depending on, pharmacy or organization that you talk to. Everyone kind of has their own triggers. And that's still kind of for you to define. However, automating, defining that trigger and having some type of an automated process to launch a follow-up is necessary. So within AR Insight, once that parameter is met, it triggers what we call a ticket to be automatically launched or created within the application. That ticket, which represents a specific account, is then automatically assigned to an AR rep who is going to work the count within the application, which hopefully results in collecting on that self-paid balance, that past due balance, or if they have exhausted all efforts, it still may result in some type of a write-off or being sent to collections. At the end of the day, you still need that patient to make payment on what they owe, and there are some patients out there that you're just not going to collect from, but you want to make sure that you're doing everything possible, to collect on them. The next piece is really automating the assignment of those accounts. And that can be based on really a number of different specified parameters. Perhaps accounts are assigned to your AR reps by, the age of the account or the overdue balance, perhaps alphabetically, maybe by location, maybe by a specific data point that's unique to your organization. That's going to vary between each pharmacy's preference. Here are just a couple examples of how our clients filter and assign their aging receivables. This particular one that we see here is by a specific data point, such as a cycle code that they use to identify specific accounts. Those cycle codes are, accounts are assigned to each one of their reps by a specific cycle code. In this instance, we have a client that assigns all of their accounts alphabetically and by age. So you have them sorted by age or by alphabetical order from the patient. In this example, again, they're filtered and assigned by age as well as by high dollar amount or low dollar amount, depending on what that threshold might be for you to assign that to a specific individual. You may have reps that take on, more important accounts because they are maybe your sort of champion or most successful AR rep, and you want them to work those high dollar amount accounts. That can all be automatically assigned to each one of those AR reps without having them go through and perform that manual process to prioritize and figure out what accounts they should be following up on. The final level of automation crucial to the AR management process is going to be automating the update and closing accounts based on payments that have been made and received. The last thing that you really want to do is waste any kind of resource trying to collect on an account that has already been reconciled. This example you see here is basically, you can see that a data entry has been made of all payments that were received and have been applied to this specific account, which is going to result in the associated follow-up ticket that you see here being automatically closed. So this ticket would have been assigned to a specific AR rep. They're not going to go in and work this account anymore because a payment has already been received and the account's been closed within the system. Consistency is a big part of the foundation to promote a successful AR environment. Your team needs to have some type of a repeatable, dependable process that they can rely on to produce positive results. It's imperative to first define the recovery process and then establish whether this process is going to be applied to every account that you're following up on, or maybe multiple scenarios that will require different types of follow-up. For example, maybe you want to limit the number of resources spent for accounts that are past due, but under a specific dollar amount or monetary threshold. You don't want to spend nearly as much time trying to collect on a $20 owed balance, that you would spend on maybe a $200 amount owed balance. Here's an example of just a standard collection process that one of our clients might use within the AR Insight application. You'll see we've defined 6 process steps that begin, first by sending a 60-day past due balance email to the patient. Notice that each step has specific instructions on how to complete that procedure and follow up with the patient. And the current follow-up step is actually outlined in red, telling the AR rep that this is what step they're in and that's what they need to perform to follow up on this account. Part of defining the recovery process is also establishing some type of timeline or expected timeline for each follow-up step, if payment has not yet been received. In this case, this is an example of how a timeline is associated with a specific process step. You can see here that there's a due date for that 60-day email follow-up step. Now, once that step is changed to the following step because a payment hasn't been made, obviously, there is another associated process step due date now with this step. So in 14 days, if payment hadn't been received, a notification will be sent to the AR rep telling them that the next step in the recovery process for this account needs to be completed on 10/27, and that would be a 60-day follow-up phone call. Practicing professional communication is imperative when AR reps are contacting patients. By instructing your staff to use some type of a pre-populated or scripted template while sending an email or making a phone call ensures that during each contact effort made, professional communication is practiced. AR reps, using this method, AR reps won't also include any protected health information, which could also result in a HIPAA violation. That's the last thing that anybody wants. In the case of this example, you see we have a predefined template that was filled out based on just a couple different variables that the AR rep could change, and now this email is ready to be sent out to this patient. And you're using the same method every time. You can certainly manipulate these templates, change them as an ongoing basis, maybe to change the message that you want to send if one's not quite as effective as another one. But it's important to implement these types of things and have, again, that reliable process that your reps can count on. Using a tool that has inherent workflow capabilities is going to allow your staff to operate efficiently. Being able to manage accounts, through some type of an interactive ticketing system, as well as logging all recovery efforts made on each account, is an ideal workflow scenario. Within this ticket that you see here, an AR rep can see what the next follow-up step is on this particular account and when it should be completed. All recovery efforts on this account are also logged with a specific date and time stamp that's available for their own review as they continue to work each account, or for managers to go in and review what recovery efforts have been made on a particular account by a particular AR rep. Automatically generating daily work lists eliminate time wasted on trying to prioritize your activities. And this is a big component and big thing that you need to have automated within your recovery process. The last thing you want to do is spend maybe an entire day trying to parse out what accounts each individual should follow up with, and as a rep, what they need to do on a daily basis and what they have done the previous days so that they're not duplicating their work. You see in this example, this AR rep who is logged into a system has 8 activities that they this particular day. They can actually bring up a list of those daily activities that show currently due or past due dates, for each particular account or process step. They can also see that particular process step and could potentially sort this list so that they could knock out phone calls in the morning and emails in the afternoon if they wanted to, just to kind of help manage their daily activities. What you need to do is really look for a resource that's going to provide some type of central arena where AR reps can access any pertinent information to a specific patient's account. This is another big thing. You don't want to waste time searching around multiple systems or files to find the information that you need to make an intelligent and effective contact effort. You'll see here within this ticket, there are details about the account that are associated with, maybe how much the patient owes, total amount due, what kind of falls in those different aging buckets, as well as the patient's name and any other pertinent information that you need. You'll see here that additionally, you can access, account history for this particular ticket. Within this ticket, has this button. You can access any statements of affiliate AR reps can actually bring up the corresponding statement during a patient's call to provide additional explanation for any inquiries or disputes. One other thing you'll notice here is, especially on statements that you're sending patients, is highlighting specific information, such as the amount that's due and a specific date. I've seen statements before where it's difficult to find out what you owe and when you owe it. That's an important thing when sending out statements to all of your patients. Next is having patient information also easily accessible. Here you see an example of a patient record with some limited contact information, but it is prevalent, such as email address, maybe cell phone, whatever other information you can collect and store for this particular patient. Now, a record of all tickets, is also kept on this particular patient account. So perhaps, you can go back and take a look and see that they've had multiple tickets affiliated with their account. You can go in and reference any of those previous successful recovery efforts, or trends, such as perhaps they never pay before their account ages to 60 or more days past due. You can go back and reference those things that helps you make smarter, more intelligent communication efforts. Specific notes can also be taken so that, if a patient has a past due balance in the future, the AR rep can follow up appropriately. For this instance, maybe Bobby does not like to be contacted before 10 a.m. And that was noted, during the first communication efforts, several months ago, because Bobby happens to be one of those patients that typically doesn't pay quite on time. But now you've got some more information for you to effectively communicate with that person. Analytics is a huge thing. On a weekly, monthly, and quarterly basis, can help identify process inefficiencies, individual performance, recovery trends, and definitely helps to reduce your AR balances over time. I've got a question for everyone here. Do you have complete AR transparency? I think it's a great question that I bet many of you can't really answer yes to. Being able to easily navigate through your accounts is really the first step in that transparency process. You should be able to search through your accounts in a variety of methods. Here we access all accounts that are within a 61 to 90-day aging bucket, and also have a high dollar amount past due balance according to the parameters set up for this particular pharmacy. If I'd like to be more specific, I can access all of my accounts that are open or closed, and then actually sort them by a variety of different data points, such as maybe associating some type of priority, for accounts. And I'd like to see all my top priority accounts and work them that way, or access them if I'm more at a executive level to see what's going on within my accounts receivable department. For them by, perhaps patient name, and et cetera. Any other kind of data points that you need to kind of search for those accounts. And even include a patient account number. It's obviously important to evaluate the performance of your AR department. I'm not telling you anything you don't know here, but how do you do that? Well, one of the ways is you can keep track of how much time your AR reps spend on recovery efforts for each account, as well as time spent on each particular step of the recovery process. It's a great performance indicator. In this case, you can track time spent within each account and on the individual process steps. That's all logged here, and you can then report on that. So let's say, for instance, you've seen or identified maybe a specific step, that in the recovery process that your staff is spending a lot of time on, but it's not really producing any kind of results compared to some of the other steps that you have. Well, you need to change or eliminate that step. Our AR Insight application affords its users the capability to manipulate the recovery process. You can, within this screen, change the details or the instructions for this particular step, or completely eliminate that step in the recovery process so that you're not wasting any more time. You need to be able to isolate any kind of bottlenecks and influence process improvement. Having the ability to take a close look at what each one of your AR reps are doing is also important in the recovery process and the evaluation of your AR department. In this particular report, you can see what was noted and done by each rep for each account. You could filter this report and compare the activity between reps, kind of identify maybe, those that are doing a better job or spending more time in specific areas and producing more results, and improve those reps of yours that don't produce quite the results that some of the other ones do, and kind of train them or coach them to become better recovery agents. Having the ability to create on-demand reports for your open and closed accounts should be available within any AR management tool. If it's not there, then you're not using the right tool. You can see here that AR managers can actually generate reports based on a number of different data points. That's important to do. Not everyone wants to report on exactly the same thing, but being able to kind of manipulate the reports that you produce is a big key component in evaluating your AR department. This example that you see here allows you to select a number of different parameters, as well as save this particular report if I know that I'm going to produce this on a weekly or monthly basis for upper management to review. I can run this report and actually pay attention to it within the application, or, also there to export this particular report into Excel or, some other similar type of data sheet program for additional utility party for review. So I've got just a few final notes here and recommendations before I turn it over and field any questions. Set monthly and quarterly goals or benchmarks for your staff to kind of work towards, and add incentives for them to reach those goals. Believe me, just having even a little something extra to work for, or work and improve your bottom line. Also, when evaluating AR management tools, it's important that you find something that's going to be flexible, that can encompass your organization's specific needs, but is also going to be affordable, such as our AR Insight application. I'd be happy to talk to anybody on a more private and further in-depth basis, or provide a closer look at the AR Insight application, on another date. So please feel free to contact me at will or at your convenience if you'd like to kind of discuss our solution a little further, or talk about today's webinar. At this point, I did want to turn it over to the audience if any of you have any questions. So I'll go ahead and turn things over to you. Great question. The Connect Plus interface capabilities, we've actually created and established integration with several PM systems. Depending on what PM system that you are on right now, would depend whether or not we have that, established already. What you see here and how we actually get data into the system, for those clients of ours that do utilize Etactics statement services, we already have that data, and we actually pull that over from the statements file and populate the information or the data within the AR Insight application. Additionally, we're able to ingest a specific AR file as well as a specific payment file, from the PM system, which all are capable of producing, and then apply those payments, to the system. And we can actually set up API calls to provide additional sort of integration and interface capabilities, with those various PM systems out there. All of our applications here at Etactics, especially the Connect Plus, platform, which supports the AR Insight application foundation that allows for integration with a variety of basically willing users. Yeah, absolutely. We'll be sending out a copy of this webinar to all of the attendees today. So we'll send that out here probably either this afternoon or tomorrow. So you can expect, like I said, a copy of that. There is no limit to the number of users on the platform. The application on a per seat basis, but you can certainly have as many as you'd like. And those users can also be limited in terms of the capabilities and what they actually see within the system. So, you obviously don't want two reps to work the same accounts, or even maybe have access to another rep's, accounts or information. So those users can certainly be set up with specific permissions, but there is no specific, number of users that have access to the system. Do we have any other questions before I kind of adjourn? Well, it doesn't appear that we have any more. Again, just wanted to thank everybody for taking some time out of your day to attend our webinar. Like I said, we do have the ability, and we'll be sending out a copy of this webinar to all attendees. And if anybody else has any questions that I didn't address right now, my contact information will be provided within the copy of the webinar that you received. So please don't hesitate to contact me with additional questions, or if you are interested in discussing our AR Insight application any further. Thanks everyone, and have a great rest of your day.